So today we have a revision case. It's a lip reduction revision. Patient has had two surgeries actually from very good surgeons in the country, but still he has some issues going on where the lower lip you can see protrudes out more than it needs to. Upper lip looks good, but at the same time, on the side when you go and look in there right there, so that tissue extends all the way to his first premolar, and he keeps biting on it. And same thing on this side as well. So if you take a look right there, yep, that's the tissue he's biting. Similar thing with the lower lip as well. And with the lower lip, I'm going to show you. You can see its lip is still pretty big, hard, indurated, so right there. And when you look on the side, it extends to the side there as well. So that's a common area that sometimes gets ignored right there all the way. There you go. So that's the goal. So we are going to try to get rid of that area and also reduce the size of the lower lip. That's the plan today. So we have done the marking, as you can see. Lower lip right there went right where the wet line was. It's about 6 millimeters or so from the lower vermilion, and the right lower lip was bigger than the left, so we have to take a little extra. I think this is the maximum width over here is 11 and here is 9 millimeters. And if you notice, I've taken it all the way in. That's where the patient is biting the tissue, so we have to go all the way past the oral commissure, and it's an ellipse. And let's take a look on this side as well. You can see the marking going all the way in. Yep, all the way inside. Now let's look at the upper lip. Upper lip was not that big, so the central portion of the upper lip, we don't need to worry about too much. So I just made an incision mark on the previous incision just to kind of improve that scar if I can. It's very hard to do it, but I'll try my best. And then only on the sides there's an ellipse, if you notice right there and right there. So let's show you this one first, because this ellipse also goes all the way in. It's past the oral commissure. Very important, because that's where people usually come back and say, oh yeah, I'm still biting tissue. And then let's show you on this side as well. There you go. So that's an ellipse going all the way in there as well. Perfect. And we did the markings to make sure everything is good and equal and symmetric, and we are ready to rock and roll. The patient has already been injected and prepped as well with betadine. And if you notice, there's some gauze in there. I place the gauze even before I mark, because the saliva is going to keep coming and wiping it off. So if you put in either dental rolls in there, or if you put in little gauze in there, that really helps to keep the markings intact. Otherwise, it's such a pain in the neck when you come to make the incisions and you can't see them. You gotta guess. You don't want that. So that's why we leave it there. And just before starting, we can take it out. We finished the procedure. As you can see, you can barely see the stitches actually, because I use for the surgical residents, I used 5-0 Vicryl for the deeper tissues. I did some undermining of the edges to make sure that I have enough tissue to put together with 5-0 Vicryl and take the tension off the vermilion itself, and use the orbicularis muscle and the soft tissue to put together. And I went way deep in the oral commissures as well, and then I used 7-0 Vicryl for the actual vermilion itself, which you cannot see. It dissolves very nicely, and it keeps it very, very fine. So this looks excellent, and we will use Medrol dose pack steroids as well to make sure it doesn't swell too much. For these patients, very important to use Valtrex and steroids as well, and lots of icing, and that's the key. Looks great. And if you want the follow-up, I will hopefully get pictures from my patient. Most of my patients come from out of state, so I never get a follow-up, but I'll ask the patient, he will be so kind to send us some pictures of his lips down the road, so we can follow up to make sure that it's looking good, and it'll help all the other surgeons as well. So great.